You're starting? Yep. Wake up, Brad. Time to go to work. Time to go to work.
I'm waking up, Bob.
Come on in, folks. Come on in, folks. Enter the dragon. Enter our domain. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, today we're going to do a 7-minute low back pain relief strengthening routine or workout. Last week,
Right.
we did the stretching routine. Now we're going to go to the strengthening.
Yeah, so your back is now feeling better from the stretch and you want to start strengthening it. We're going to show you some introductory strengthening exercises, and some will progress.
Some will be a little more advanced,
Right.
but you'll find some that'll work for you. These should be pain-free.
Right.
There's no reason you should have pain while you're doing these. So if you're having pain, you're going to back off and not do them.
Make sure you listen to us. Use good judgment.
That's right. Listen to me now or I'll tell you later. Or something
There
like that.
you go.
If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, if you're not already, go over to the Facebook and like us, Bob and Brad, because we're giving out cool vibes
There
to
you
all of
go.
you who subscribe to us and like us.
And if you're watching on Facebook, you can ignore that part.
That's right. Give us the likesies and the thumbsies and the heartsies. Right. So the way we're going to run this, we're going to do the program. It's only 7 minutes long, so it shouldn't take that long.
And 7 is a complete number.
Yeah, you love that number. And after that, then we will take questions and answers. Well, we'll take questions. We'll give the answers.
We'll provide the
And
answers.
we do answer questions on relationships too, because we can fix just about anything
Except for
a broken heart.
there you go.
So,
Should we get going?
yeah, let's
Bob?
get started. All right, so the first one we're going to start off with, Brad's going to start up on the mat here. You can do these on a floor. You can do these on a bed. The first thing we like you to do is be able to know where a neutral spine is. So you can, I don't know if you can see this. We got a little bit of coloring here, a little band there. All right, that probably wasn't wise to do, Brad.
I wonder if we should show them the spine.
Sure.
We want to give them a little
Where's the
skeletal
spine? Sure.
information. Yeah, let's
So-
hang it in the usual spot.
So we got the pelvis here, and if it's if it's anteriorly rotated, it's like this. You have an arch. I'm going to come up a little bit if you don't mind. Okay, it's arched like this. If it's posteriorly rotated, it's like this. So what you want to do is flatten your back all the way, and then come back off a little bit, and that's neutral. So Brad's going to do it now. He's going to, if you got your hand here underneath, he's going to crush my hand. So he's flattened. Now he's going to back off a little bit. No, not back off, a little bit. Just, not a whole.
We're going to go. Yeah, we're
Yeah.
going to find a neutral.
We're finding neutral. So once he finds that neutral, that's where you want your spine when you're doing these exercises.
Good point.
Summary. Okay, Brad, why don't you start off with number 1?
I'm going to find neutral first.
Okay.
Arch, flatten, halfway in between. There we go. I've got neutral. Tighten up the core. And the first.
Houston, we've got neutral.
There we go. Shall
All
we
right.
proceed?
Yeah, let's proceed.
All right.
So you're going to do one? The leg lifts.
Okay, so we're gonna. This is straight leg rest. I gotta tighten that core up, neutral position, and I'm only gonna go up to here. If you want to go up higher, you can. Again, pain free. If your back isn't ready for this yet and it hurts, it means you need to go back to some of the stretching from last week.
Now you could do it if you were pain-free. If this was too long of a lever arm, you could start right here, Brad, couldn't you? Just go like
there
that.
You go. Good point.
That would be a way to start off with if you are having pain to back off a little bit. So he's doing it on both legs, and then when he's ready, he can go ahead and do the full straight leg raise.
All right. Again, keep that neutral position. You're really thinking about this part, not so much the leg movement, because that's the core we want to strengthen around that back in that good neutral position. 10 repetitions is a good place to start. If
The
you
thing you may not realize is your abdominal muscles, they come all the way around, and they attach at the fascia that attaches into the back.
Right.
So this is all like a big corset. You want to strengthen the core because it'll also strengthen the back.
Right.
So
There you go.
or save the back and keep the back stable. All right, next one, Brad. You're going to go ahead and do the dead bug or whatever you want to call it.
Yes. So this is when we can start with this left knee going up, and then bring your arms up here. Then I'm going to go up with my right arm. So it's alternate. And while I'm doing this, neutral back position, tighten the core, and we get motion along with a stable core. And we'll do 10 on this side and see how that feels. And we'll do 10 on this side. If everything's going good, you got a good arch, or a good neutral core, then we can alternate. And what I'm going to do is show you a progression. So as you get stronger, alternating is a little bit harder. And then you go to we call it the dead bug. This is quite a bit harder. And I can feel my stomach muscles really work much more now than opposed to when I'm doing just this.
Brad's making this look pretty easy. Brad's in shape. Brad's been doing the core workout. He's strong like bull.
Strong like bull.
Yeah, so he's bullheaded too, by the way.
That's very true. Ask my wife.
All right, now you're off the table, Brad.
Okay.
I'm going to go ahead and do some pelvic rotations. And by the way, watch how I get into bed here, Brad. I don't go like this. I go onto my side because I'm keeping my back protected.
Sure.
And I'm rolling onto my back. We're always teaching, right, Brad? We're always teaching.
A good therapist is a good teacher.
So this one's a little more difficult. You're going to start with what we call the hook line position.
Right.
And you're going to bring your legs up, and you're actually going to go back and forth like this. So now we're getting some of those abdominal muscles that are the obliques.
Right.
That actually bring you side to side here.
Those crisscross muscles that go across that abdomen.
I got my hands down flat here to give me a little bit of stability.
Now, we're doing this on a table or a plinth. At home, you can do them on a carpeted floor is our best location. If you want to do them on your bed, that's okay, especially if it's a firmer bed.
And if you're a little crazy, you can do it on the kitchen table. I'm just lying there now, right? We're goofing around.
Just make it.
Okay. All right. So you can do a bunch of those repetitions. I work the obliques. Now I'm going to go ahead and do some bridging, just simple old bridging. This one always works real well for working the back and the core.
Right. And again, just a reminder, Bob's thinking about keeping that back in the neutral
position the whole time.
We started out with that, and it's going to follow through all of these exercises.
So that's 6 or 7. I kind of lost count.
Oh, Bob, it's your job. Now you have to start over from one.
Yeah, you know the rule in therapy. If you're in our therapy department and you forget to count, you start over at 1 again.
That's right. We have people doing hundreds of them.
Yeah. All right, now we're going to make it a little more difficult. I'm actually going to bring the leg out, and I'm going up like this. So now we're getting a little hamstring strengthening too to add into that.
Right.
And the reason that's good is because the hamstring does come up into your back. You know,
it's all part of the chain.
Yeah.
So now his left leg is the one being strengthened in regards to the hamstring. All right.
Reverse here.
Oh.
Unbelievable. Makes the core work a little bit harder.
This is unbelievable. Bob, it looks good.
You can't conceive it. Though.
Yeah, you've got those nice, what do you call those?
Compression
shorts.
Yeah.
By some
thankfully they're on. Otherwise, I'd be showing a lot of leg right now.
Yeah, that's not going to happen on this. It's a family program.
All right, thank God. All right, Brad's going to jump back on the mat.
Watch out, Bob. I'm going to jump.
All right.
Just kidding. Nice, easy. Take your time. Okay. Now we're going to start a more traditional core strengthening. I like to bring my knees up in that hook line position here. It puts your back in that neutral position without thinking about it so much. These are crunches. I prefer putting the hands across on opposite shoulders. And you're only going to think about bringing your shoulder blades and your head off the table or the floor.
But look how he's keeping his back stabilized on, it's on the table the whole time.
And your head, don't do this. Because that's not
going to help bringing the head up towards the ceiling. Right. Brad, you want to talk about breathing? Somebody mentioned about how you should be breathing.
Right. I had another person comment like, well, if you're not breathing, you're not alive. But we're not talking about just breathing. We're talking about make sure you breathe, in your mouth, exhale out your nose. But when you put the energy into the exercise, here we're going up. That's when you're going to exhale.
Is it in through your nose and out through the mouth?
Yeah, in the nose.
In through the nose, out through the mouth.
Coordinate the breathing with the movement. You'll find that you get less tired, you're more relaxed, and you'll have better results. And that does take practice. Some people more than others, but it's one of those things that you'll want to focus on forever.
All right, next one, I'm going to give you a couple pillows, Brad.
Oh, nap time.
All right.
Okay.
Flip over onto these, Brad.
Okay, so we're going to work the Now, with core training, a lot of people think it just means stomach.
No, we're doing core and back, low back. So
But core really refers to all the way around.
all the way around.
So
Somebody
we
had
have-
asked that question. It's like you knew they'd ask.
Well, yeah,
Yeah.
we've got karma going on
Yeah, that's
with our
right.
viewers. All right.
ESPN.
Maybe that was Alex again.
Yeah, I think it was.
So we're putting this underneath the stomach so that you have a raised area. You can do this with a big exercise ball, but if you don't have one, this works good as well. All right.
So we're going to go ahead and do alternating right away, Brad. We're going to jump right into it. Yep. It's alternating arms and legs.
So you're working hip, low back, upper back, a good stabilization exercise for the back. Now, if you want to, just to start, you can go one arm,
And one leg, right.
thumb up. Sometimes I even have people start with just the arm, just to get a feel for it when they're starting. You know, and then in alternating, if you're doing the left arm going up, the right leg should be the one going up. So it alternates, it gets a good muscle combination for the core and the back strength.
Somebody asked about crunches, and they said we were kind of doing them. It's like, yeah, you can kind of do them, but you do not do a full crunch.
Right.
Again, as Brad was doing, or as he demonstrated, you're keeping that back flat in that neutral position, and you're just kind of lifting the head. So,
Oh,
all right, now these next ones are kind of focused on just the arms. The first one he's going to do is he's going to put his arms in the Y position. Y, Bob, right?
why? Or this is the field goal.
The field goal, yeah.
Yes. On this one, thumbs go up towards the ceiling. I hope they can hear me. I'm talking.
Thumbs are going up.
There you go.
And then he can do the T, going straight across. No, out this way.
Oh.
There you go. Yeah.
It's like you're trying to fly.
Yeah.
But you can hold it and focus on your shoulder blades going
Squeezing together, yeah. So this is a little more focused on the upper back, but the upper back connects into the low back. And if your posture is bad up here, it's going to affect your low back. So it's a great one to do. And then he's going to finish up with the reverse Y.
Oh, yeah.
So now he's going down, yeah. And then on this one, he's got his thumbs down on this one.
Yeah. You know, I can feel my whole, from my belt line up to my neck, all these muscles are getting a nice workout right now. Starting to get warm.
Okay.
Starting to burn just a little bit, Bob. I
All right,
feel the
Brad.
burn.
You're on vacay now.
Oh, I'm off?
You're off.
Oh, yeah,
All right.
definitely a good back exercise.
All right, I'm going to go right to the little more advanced version of this now, as to where you go ahead and do it, you get what we call the quadruped position, meaning 4.
Hands and knees.
So I'm keeping my neck in kind of a neutral position instead of going up like this. And I'm going to go ahead and go opposite arm and opposite leg.
There you go.
So this takes a little bit of balance and takes a little bit of strength.
Now look how Bob is nice and straight all the way across. That's what we're looking for. And he's working a lot of stomach muscles to maintain that neutral back position that we talked about in the very first exercise. See how it all comes together.
And as you might imagine, this is called the pointer dog because obviously I look like a pointer dog.
Right.
So
Yeah, I like that name. It's fitting.
it's very descriptive. So
Again,
which way did he go?
10 repetitions is a really good goal to start out with on all of these.
Okay, I don't know how many that is. I screwed up again,
You
Brad.
got to start over from one, Bob.
Well, we're not going to make the people go through it.
No, yeah.
If it was just me, I'd punish me. But
Well, after we're done with the video, you'll have to come back.
all right, now we're going to go ahead and get some of the muscles more on the side here. So we're going to start off with the more easy version. You're going to be on your knees like this. You're going to start in the neutral position here, and you're going to lift up like this.
Now, I just want to talk about what we mentioned
And I'm
early.
breathing. Go ahead, Brad.
Early in the video, if these create pain, you shouldn't do them. I know this particular
Yeah,
one.
Brad would not like this one.
I never do this one anymore because my back condition got spondylolisthesis, or you may have another issue. But I just wanted that brought up that
Yeah, there's certain people aren't going to like this one.
right.
But-
But as well, maybe other ones too. But I know this one is pretty.
You
You're
can
getting
make it
pretty-
harder then by going to your feet.
There you go.
I'm actually slipping off.
Oh, we got to get a longer plinth.
Yep.
So
6'6".
Yeah, we got the 6 foot plinth.
Yeah. So, and then obviously I would do the other side too. Do I need to do it?
No, we don't want to see your backside.
All right. Then we're actually going to use a chair, Brad. You want to find the chair without arms?
Oh, the armless chair.
Yeah.
I forgot about this one. This is a nice one to work on.
So again, this is more advanced. You go ahead and kneel down, and in some cases, you could actually put your feet up against the wall here, Brad. If you had like
Right.
grippy shoes,
Back
it would
here.
help hold you.
Yeah.
But you can go ahead and you can work on start doing these like the Superman fly.
This is working basically the same exercise that I was doing with the pillows underneath, but it's a little more aggressive.
It's a little more aggressive and it's getting the low back more, Brad.
Yeah.
So
Yeah.
my low back is really firing up here on this one.
I personally do this one on a big exercise ball, but you can certainly use a chair like this if you don't have a ball. You'll find the ball is probably a little more comfortable. But
You could use one of those footstools too.
the ottoman.
Yeah, that's called ottoman, right? I don't know what women call it or men.
Bob, no,
Well,
don't
okay,
get-
all right. I'm sorry.
You got sexist.
Yeah, I got sexist there. Sorry. So
It's a family program.
okay, so I'm flying away, Brad.
That's a hard one, isn't it?
It is a hard one,
There's
but
arteries coming up.
it really works well. I mean, I really feel that in the low back. And then I want to show you a functional one.
Okay.
This is one, throughout life, we're going to want you to lift properly. And so when you squat down, Brad, do you want to use that?
Yes, I do.
So I squat down, we got the 3 points of contact. Point, point, point. If I only have 1 point of contact, I'm too rounded out.
Right, and that hits you in the head like
Yeah,
that.
that
a
hurts.
reminder.
So I like to do these. I do squats, I go
Right.
down, and I come up like this. And this works on my posture and strengthening.
It really is a
So,
good all-around
It's
exercise.
just a good all-around exercise. I'm going to show it to you from the side, and then I'm going to show it to you from the back, or I mean from the forward. What would that be called?
The front.
The front. The forward.
Oh, Bob, you're killing me. That I really
You
do.
guys try to do this under pressure.
Yeah, well, yeah, this is. Yeah, we've only been doing this for 7 years now.
That's
You
right.
never-
What did I call it? The forward?
As we digress,
All right.
we're going to answer questions pretty soon.
Now we're
because
going to start
we've been
taking
doing something.
questions.
Sick and tired of you watching me do this.
So that was the 7-minute program that only took 20 minutes. But so, Brad, you want to see if Liz has any?
Liz, can you read any of the comments? Or they're not fit for the air?
So far, so good. One of them is, what does the Y do for your back? The Y.
What does the Y do for your back?
So she's talking
About this one
Yes,
here.
it's a good question. Do you want to show or?
Well, you're strengthening a lot of the different muscles that are around the shoulder blade.
Right.
And
The postural
now
muscles.
watch me. If I have bad posture in my upper back, watch what happens. I go like this. What does that do right away, Brad?
That stresses the low back.
Low back also. So in order to keep the low back out of trouble, you have to have good posture throughout.
Right.
You can't just have good posture in your low back and then be rounded out here. So we're strengthening the whole entire back.
Right. So what happens up here directly affects here as well as the neck. So it's a good question. Why are we thinking about here when we're talking about the low back? It's
So the Y would be the lower trapezius, the rhomboids.
Sure.
Any other ones you can think of, Brad?
Well, there's a lot of muscles.
There's a lot of
I'm not
muscles
gonna
in
go
there.
through them all.
Yeah.
You're gonna test me under pressure.
That's right. You got to be under pressure. I got to come up with
I know.
front. So
Any
All
other
right.
ones? Or can we go eat?
Nancy asks, can you do these now if you have a slip disc?
the question is, can you do these if you have a slip disc?
It depends on what level of rehab you're in. If it's very acute and there's a lot of pain, and you may have pain down your leg, if it's in and you're limping or that kind of thing, you're not going to probably do these.
No, you want to start with our program, the videos that we have where you do the McKenzie program.
Right.
The stretches we did last week, some of those might be more appropriate.
You just have to try them, and if they create no pain while you're doing them, they actually just feel like a good exercise, you can do them. But if there's any problem with doing them, then if there's
While
pain-
you're doing it, or even immediately right after,
Right.
if it's bad, you can't do it then.
right. So
That's a good question, by the way.
Right. So you can try each one of these, and if you find one that actually feels good while you're doing it, go ahead. That's good as long as it feels good later on. You're not going to do all these at once for sure. It's just one of the things you have to use good judgment.
Well, this is an easy one. Somebody wants to know, let's see, who is it? Dimitri Nakos wants to know, will this video be available later on because it's live now? Yes, you can watch this again and again until you're sick of us ad nauseum.
Right.
It'll be available on YouTube and on Facebook.
Sure.
So,
yep, just get yourself a cup of coffee, sit down and put us on the big screen and just hit repeat.
yeah,
Yeah, you'll get these exercises memorized.
you can have that barf bag right next to you. I'm trying to be funny.
Yeah,
It's not working out. So,
shall we go on?
doctor told me that so this is fruity fruit. That's quite a name, fruity
Yeah.
fruit.
Pretty good.
Doctor told me my disc is moved and it's hurting the my sciatic nerve. Can you give me details about moved disc causing sciatica? We got to blow out the cups, Brad.
Yeah, we're going to actually, discs do not slip. The whole disc doesn't move. Discs have fluid inside and they bulge out, I think is a better description. We have a really nice model.
Let's bring this up a little bit, Brad.
We've got this is one of those things that I think
okay on Facebook.
we're going to do this because so many people have disc problems that have us.
So this represents the bones in your back. You want to grab the spine there, Brad?
So specifically, we're talking about the vertebra. You've got the.
So there, here's the 4 bones that make up your back. This is 2 of them, and they're enlarged.
5.
What did I say? 4?
Yeah.
I'm really having trouble today. There's sometimes 6.
Yeah. Right. Some people have 6 lumbar.
So anyway, you have the vertebrae, and in between you have the disc. Now, on a good, healthy disc, it's going to give you a little bit of height. It's going to allow you to move forward, side to side, backward.
It allows this.
Now, over time, especially if you do a lot of bending forward or a lot of sitting, the back of the disc starts to wear out. And what can happen is this.
Let's see if we can see this.
Can we see it?
Let's go this way. I think this camera.
That camera can't see it as well.
And then we can't zoom in today with this
Pushing
camera.
it out.
And
Pushing it out.
Think the disc actually starts to open, or not open and bulge. It can open and sequester, they call that. That's getting more serious.
So meanwhile, there's these nerves that are coming out on the side, and this bulging disc or herniated disc hits the nerve, hits the sciatic nerve, sends pain down your leg. So what we try to do with exercise is actually encourage that disc to go back in place.
Right.
And that's where we do the extensions quite often.
Yeah, so all these exercises today are not specific to do those. This is more after the disc has taken the pressure off the nerve, and it's time to get things strengthened for more activity.
But again, if you type in, Bob and Brad, like sciatica, you're going to see our whole playlist of what to do for a problem like this,
right?
Especially on YouTube, if you go to YouTube.
Right. And we use this model where we have some good close-ups, and you can see it a little better.
Right.
A lot better.
Hi, guys. This is Mina V.
Whoa.
You often say pain from the knee down after PT for stenosis is bad because it should go up the leg. Why is it bad? So what we're talking about is the further the pain goes down the leg, the worse things are getting.
Right.
So,
in general, I mean, there may be some exceptions, but most of the time, if you have pain, and it's often it can be pain, burning, numbness, tingling. The further down the leg, below the knee, is kind of a benchmark that therapists kind of look at. I don't want to get into reasons for that, but if you got it going below the knee to the foot, that's a good sign.
It's getting serious.
Right. It's a good sign that's getting serious.
Right.
It probably is a pinched nerve up in your back.
Yeah.
Or it could be a piriformis problem.
So what you're seeing again, generally the way it progresses is you first feel pain here, then it starts going down in the butt, then it starts going down in the upper leg, then it starts going down here and into the foot. Again, gets to the foot, it's getting serious generally. Right. That's when often you might get drop foot.
Right.
You want to get things taken care of so they don't become permanent.
I just want to put in, I think she mentioned something about stenosis. If you have stenosis and you get pain or tingling down your legs with standing or walking, but as soon as you sit down, if that goes away, it's a real consistent sign with stenosis. That's probably not as serious depending on how far you can walk functionally, but it's a little bit different with stenosis versus a disc problem.
Anything on Facebook? Otherwise, I got some more here. I can.
Sure, yeah, one more. Kathleen is asking, do you need to go thumbs up to hit the subscapularis in a face down movement?
So Kathleen is asking if you need to go thumbs up to reach the subscapularis in the face down movement.
So she's talking this.
Yeah.
Yeah.
We actually, I know when they're teaching this method, they actually do thumbs up and they also do palms down. They do both, so you can make sure that you're catching both.
Right.
So,
And I think a lot of that also has to do with how the joint, the shoulder joint, is more comfortable as far as the greater trochanter
the
bump.
subscapularis is an internal rotator, though, isn't it? So
Well,
this isn't going to get the subscapularis at all.
That's right. I was
Yeah.
thinking in the
Yeah, the subscapularis is one that brings it in, not out. So
Right.
you're not going to strengthen the subscapularis with this exercise.
Just stretch it.
You'll stretch it, but what you need to do is you'll need to get a band or something like this, and you're going to work on like this to work the subscapularis.
I wonder if that was a test question.
I wonder if we passed.
Yeah.
Hopefully we did. We got maybe time for one more here. Okay, my mom is suffering. This is Vinay Kumar. My mom is suffering from stenosis at L4, L5. Doctor suggests surgery. Is it necessary to have surgery?
It may be, just like this, there's no way we can say.
Yeah.
I know I personally have stenosis in that same area where I have numbness tingling down my leg. I've been able to work it out with exercises, but that doesn't mean everybody can.
Right.
We have some really good videos on stenosis exercises. So if you want to Google Bob and Brad stenosis, I think we have a playlist for stenosis. We've got at least 2 or 3 and maybe more.
Because Brad has it, we've done a lot of videos on it.
Right.
And basically our belief system is first you try to do some things to see if you can decrease the pain on your own.
Right.
Because obviously surgery is a major thing.
Right.
And I don't take surgery lightly, especially on the back.
Mm.
So I would definitely try things before I try the surgery. Now, you can get to the point where it's just so bad you have to have it. I mean,
Right.
there's just no doubt about it.
And the good thing about that particular surgery, they're just removing either some soft tissue or some bone, likely not putting hardware in the back.
Right.
That's not a real
As bad.
complicated surgery.
Yeah,
And
not
that's
as
good.
bad.
Right.
Right. So, all right. I think we're going to have to call it here. We will catch you again live next week. So we want to thank all of you for joining us, and leave your questions and comments below. We always try to take a look at them. We may not answer because we get hundreds of them a day,
Yeah.
but we do what we can. So thanks for watching.